Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey, everybody. Crystal Stokes here. And today, my guest is Dr. Caitlin Vaughn. Now, she's worked in veterinary medicine for about 25 years. And in that time, she's held many roles, from kennel assistant to technician to veterinarian to mentor, working both in large and small specialty centers and general practice. After fighting her way through burnout without much guidance, she came to be a coach and founded Unlocking Vet Med in order to help veterinary professionals in similar circumstances. She believes that sharing our stories gives us strength and wants you to know that you're not alone and you're right. It does not have to be this way. You can change. So, Dr. Caitlin, thank you for being on today.
Thanks for having me.
Fabulous. Can we start with a fun little icebreaker?
Sure.
Okay. How about one of your most fun animal or veterinary experiences?
There are quite a few, but one of the most memorable moments for me was walking in to the ER for the start of my shift before we'd even rounded or anything. And this wonderful technician is cradling a kitten with its head stuck in a mason jar. And she's got like a little oxygen line like shoved up in there. And she's just looking at me and she goes, "I need some help." Because the overnight doctor was doing overnight things and this poor little kitten was struggling. So as it turns out, there had been peanut butter in the jar and he just wanted to have a snack. And his owners, they were doing the right thing, trying to get him out, but he was coated in like olive oil and butter. And he was slippery. It was like a grease thing. So we had to sedate him. We got his head, he was totally fine, recovered without incident. But I have a picture of it because it was too funny not to. But I think that was probably the funniest way I've ever started a shift.
That is adorable, and I can picture all of it. It's very vivid. What color was the kitten, so we can all picture in our head?
Oh, he was like a little gray tiger, sort of generic looking, domestic short hair.
Yeah. So sweet. That is an adorable story. Well, so we're here today. We're talking about vet med and going through that experience of burnout, the common struggles that many veterinary professionals face. And you've had your own personal experience of going through it, as you mentioned, without much guidance. And here we are on the other side of that, where you have a coaching practice that helps support veterinary staff. I'd love to start with some of your origin story to talk about what life was pre-awareness, that there was support out there, such as what you're offering, and some of the common challenges that you were facing that others might relate to.
Yeah, I think that's a great start. I think just real briefly, I did an internship when I graduated from vet school, went straight into emergency practice for about five or 6 years, and then went into general practice. And so I think that part of my burnout story is a result of a culture where we celebrate achievement. And it was go, go, go. And it was always like, what's next? What's next? What's next? And then working in emergency medicine, the volume and the weight of the cases, I think I can say, since I worked in general practice as well, it's a lot, right? Like it's a lot at once. It's heavy emotions without much time to process. And nobody ever really taught me how to do that. And nobody really modeled how to do that in the clinics that I was working. And so I sort of got to a place in emergency where I was just doing a job. And I suddenly sort of had this awareness that I didn't care anymore. I didn't care about the people and I didn't care about the pets. And that's a really hard thing to say as a veterinarian, that like you don't care, but you're just sort of numb. And I think that's what burnout is, right? Where you can't find it in yourself anymore. And I think that was the moment for me when I realized, like, I think I need to leave emergency medicine to work on trying to get myself back. And that was a really hard thing to do because I think I felt like a failure. I felt like I couldn't hack it. I felt like I was not as good as everybody else who managed to stay in emergency. And that was a really hard thing to kind of get over. And I think that I was talking to my husband about this morning, that I think my whole story, from realizing that something was going on to finding a way to change it and sort of coming out on the other side, I think was about 5 years. And that's a really long time. And I think that's I feel like that's pretty standard from the stories that I've heard, is that, in order to, the awareness of change, the changing, and then the sort of feeling like you've made it, is about 5 years. And that's a really long time to struggle. And I think that for me, I sort of got to a place where, after I learned all the tools and I started to apply them, I sort of looked at my colleagues and the technicians that I was with, where I'm like, everybody's miserable. We're all suffering. Like, nobody is happy doing this job anymore. And here I am, like, on the other side of it, like, I figured this out, And watching people struggle and watching people hurt in ways that they don't understand was really a driver for me to get certified as a coach. To say, is there a way that I can, maybe a little bit more formally, help these people? Because I believe that veterinary professionals are kind and compassionate and strong and resilient. But I know when I was in the middle of my burnout period, I wouldn't have believed that. I mean, people were telling me that, and I was just like, I don't feel it. And so I think that we need to kind of shift the way we're talking about our experiences and sort of highlight the fact that we are resilient, that we are strong people, that we have made it through a lot of things. And so in the end, I just decided, like, if I can shorten somebody else's 5 years with the knowledge that I have, like, let's do it. Let's have different conversations in the profession.
It's so true. We definitely need to have different conversations. And I love your motivation to shorten that cycle of learning and coming to the other side. My company's called Full Circle because I had a very similar experience to you. And I think my timeline was also very similar. I think the burnout I had was an overnight ER, and I had the same story as you. So those people listening, right? Maybe you need to share this podcast with somebody else if you notice these signs in them. This is a very common feature that both Caitlin and I just described, which was, we thought it was us. There's something wrong with me. I should be able to keep up. I should not be feeling this way. There's something wrong with me. I'm a failure. If there's that narrative going on inside of your head, or you may be managing somebody or working alongside somebody and you suspect that they're feeling that way about themselves, that's an indicator that they're stuck in this negative downward spiral. And I think what really happens is that we're a group of achievers, right? The people that pursue a medical route are nerdy. I'm putting my hand up. Like, we love to learn. We work hard, oftentimes having difficulty taking breaks or resting, tend to be very giving, maybe giving too much, but not giving to ourselves. There are a lot of these common features that we share that are traits that are wonderful in many ways, but when used to an extreme can be detrimental. And I really like your message, Caitlin, how you're bringing in your story, trying to help people recognize if they are, maybe entering into a bit of burnout, or maybe they're already deep into burnout, to know this is not a forever thing. You don't have to leave the profession. You can get through this. You are resilient. And that's what we're here to talk about today, is your ideas around coaching and all that you have learned and that you want to bring to others to help get to the other side of burnout, come full circle back to the passion and joy that you had for veterinary medicine. And can I just ask, because maybe curious minds want to know, like I want to know, you mentioned that you felt that sense of, I just don't care anymore. And that was such a strange feeling, that numbness of not caring in general. Two questions. Did you also feel that numbness towards yourself? Like, were you numb towards your own emotions and caring about you? Did it translate to all parts of your life?
Oh, 100%.
Mm-hmm.
Yeah.
Because I think a common experience with that is that when people feel that numbness, they think, this must mean that I don't really love veterinary medicine. It's not true. It just means your gas tank's empty. It's like, if your car doesn't drive because it's out of gas, it doesn't mean you need to get rid of the car. You just need to get some gas. And I think if we can refuel and re-energize the veterinary professional, their passion comes right back. So my second question is your passion back? How do you feel about animals and
Yeah.
clients now?
I love that point too, because I was at that crossroads where I was having that thought, like, do I need to find something else? And also, I have too much debt to do anything else because I don't have any skills that will allow me to make the income that I'm making. And so I sort of had a moment. I did a strategic job analysis that was sort of like, are you aligned or misaligned with your career choice? And then are you aligned or misaligned with the job that you are doing currently? And that was really valuable to me because it was 100% aligned with my career choice. Like, vet med has been a passion of mine since I was a small child, right? I've always loved working with animals and the people that love them. And so that was an eye opener to say, no, I belong here, but maybe I need to do something differently. And so that was sort of where the step down from ER in terms of mental health. And it's hard because I feel for my colleagues that are continuing to work emergency. We are all stressed to the max. Everybody is overloaded. And I felt kind of like I was doing a disservice to them when I stepped back a little bit too. But I needed to do it for me. And once I sort of recognized that, um, and I wasn't completely bogged down all the time, and I had a little space for recovery between the shifts that I never really felt on emergency. I started to not feel so terrible when I was going in. And it was sort of like inching back to loving my job again. And changing how I showed up kind of changed how people showed up with me, and changed the interactions I was having with my clients. And I work full time as a mentor now to new grads, but I do still work a little bit of relief on the side for my old clinics because I love them. And I adore those shifts for many reasons, but I feel like I can actually show up and see the clients and treat the pets. And that is something that I haven't felt like I've been able to do in a long time. And so, yes, short answer, I guess the long answer,
Yeah.
I do. Like, I have found that love again. So it certainly is possible. It took a lot of work and time and dedication to learning all the things that I've learned, and trying things and trying to show up with a different attitude on a daily basis, but it's possible.
I think people need to hear that to have hope. It's so comforting when we're in that painful place to hear of others to say, hey, you're going to get through it and you're going to feel that love again and it's okay. And I also really like the point you make that the paths are varied to get there. So for some people, they might need to change their role fit. It might be that working in that specialty is not good for you, or if it's nights, maybe you need days, or the type of culture of the hospital, or maybe do better in research. There's just those are things just as cultural, like the fit of the actual work. But then there's also like what you're alluding to or talking about today too, internal tools, mindset, how we take care of ourselves, how we better understand the way we're thinking about the situation. So we have external and internal things we can all play with, and just to let people know that you'll find your unique way. But there is a way forward. You're a perfect example of that. I think the conversation today will highlight some ideas for people of where they can just get some traction, how they can get started. I wonder where we should take the conversation next, kind of along this journey of people who are listening, going, yeah, I relate to this. Now what?
Yeah. So I think for me, and this is a common theme that I've heard from my colleagues and my friends who don't work in vet med, but you get to a point where you feel really stuck. And I think that stuck is probably the best word, where you're like, hey, there's this dissonance. I don't like where I'm at, but I don't know how to change it. And is this life? Is this what I do? I just do this every single day and I feel like this? Like, why? And so maybe it's a little bit of like an existential crisis. I don't know. But that's sort of where I was. And that actually led me to seek out coaching, because I was in a situation where, I had done some therapy in the past and it was helpful at the time, but I kind of felt like I want some practical tools. I want somebody to give me like give me a 5-step process to reduce burnout, and then I'm going to go do that, and then I'm not going to be burned out anymore. And so that was sort of, I thought that that was a thing, right? Because there's all those BuzzFeed articles like, 6 easy steps. No. But that's what I was looking for. Is I was looking for somebody that had gone through, that had like written a little book on this is how you fix this problem. And that's sort of how I came to coaching, in a way that I was looking for somebody that had been through it, right? That had some personal experience with burnout, some personal experience with changing some unhealthy habits, and could guide me through that in a way that I can really practically apply those tools. And in doing all of that, I realized that those tools are applicable in every single aspect of my life. And I was talking with a friend just, I think yesterday, this weekend, and she said, if I had known how valuable coaching was going to be, I would have done it a lot sooner. But we come from this culture of like, keep your cards close, like, don't share that stuff. And I think you have to get to a really deep place of dissatisfaction to kind of get over that step and say, you know what, I need some help with this. And I have no idea where to look for that, but I'm just gonna find somebody. And that's sort of how I went through, and found coaching. And then as I was coached, and as I started doing my own reading and amassing my own sort of library of knowledge, I was like, oh, I wonder if somebody else might find this helpful.
Right?
And that sort of led me to, maybe I could become a coach. And at the time, the first time it came around, I was like, you know what? I don't think I'm ready. I don't feel secure enough with my own stuff to try to help somebody else through their stuff. And then about a year later, I said, I think I'm ready to do this. And I think I know who I want to help. Because I think that was part of it too, is that initially it was habit change and that sort of thing. And then I realized that negative thoughts are habits. And those loops you get stuck in are habitual. And so if you can use the tools for physical habit change, like drinking water and stuff like that, to actually change the way you're thinking. And that's sort of how all of this came to be, I guess.
Oh, your entry point is so wonderful. I think that people will relate to that feeling of being stuck. That's a feature too of burnout, is a hopelessness, that nothing I do fixes it. I take a day off, it's not fixed. I do a vacation, it's not fixed. I try to self-medicate, it's not fixed. I even changed jobs, it's not fixed. And so that sense of, I am so stuck and I have so much debt and I can't do anything different. I don't know. I'm at the bottom of my resource bucket. I think that a lot of people do start looking for help in that way. I think another thing that might motivate people to think about too is that I love to think about coaching as like sports coaching. You want to get better at a skill. You want to learn tennis, you get a tennis coach. And how much faster you progress in that skill set than if you just tried to like do it on your own or look on YouTube, right? It's night and day. So some people I think also become motivated to do coaching just because they like to achieve and they like to grow. And a coach is like your own personally tailored companion to give you the resources and tools that you've been wanting all along. And I find most of us just don't have a language for it. I always thought when I was becoming a psychotherapist, why the hell don't we teach this in like 5th grade or 3rd grade? Like skills about how to be aware of your thoughts and work differently with thoughts and behaviors. How tremendous it would be to know how to regulate emotions at a younger age, or even awareness like in college or high school. If we just built these classes in, but we often don't have a language around it. So we just feel like we're struggling, but we don't really know how to explain what we're struggling with. And I'd love to let this lead us into talking about negative narratives and new ways of thinking. Because I think that negative thinking can be, like you mentioned, such a habit we don't even realize we're doing it. Like, I didn't realize I was biting my nails. Yes, you were. Tell us more about that.
Yeah, I think so. One of the things about VetNed is that we are passionate people. And what I kind of have been feeling like lately is that we're in this echo chamber of the profession sucks, our job sucks, the clients are terrible, the pets are aggressive because of COVID, and I don't want to do my job anymore. And when you're that's bouncing around on all sides, That's really, really difficult, right? That makes me feel uncomfortable. That makes me feel anxious, right? And so, one of the things that I try to highlight again is the resilience, right? And so, in my job with the new grads right now, that has really brought that to the forefront for me. These guys were in the middle of their education when COVID hit, right? So not only did their academic institutions have to be a little bit resilient and flexible, but some of them were stuck at school. Some of them were stuck at home. Many of them didn't get the hands-on training that they would have gotten otherwise, and some schools adjusted for that. But by and large, I think that their education was completely disrupted, and I think that's true for anybody that was in any sort of formal education during COVID. And so they're coming out with a different narrative. They're coming out saying, "Here's all the crap that happened to me in the last 2 years. I'm still a doctor, and this is my job, and I get to do this every day." And that has been phenomenal. Just watching them show up and be excited and passionate, I think has brought a lot of my passion back too. And I think that there's a lot of conversation about, if you ask a veterinarian if they would go back to vet school and do the job again, a lot of us say no, and here's why. And I say absolutely, but also here's why, right? And so I think an eyes wide open approach is really important. But one of the things that sort of really shifted my thinking was when I realized that the loops that I was in actually influenced my behavior.
Ooh, pause right
And
there.
so,
Like, say that again. The loops that you were like, your thinking loops, the
yeah,
things you were thinking were
yeah,
influencing your behavior. How so?
yeah. So I think one of the best examples in vet med is um, when you look at the schedule and you see Mrs. Smith on the schedule, and you're like, oh, our appointments are 15 minutes and she always takes 45 minutes and I can't get her out any faster and she doesn't listen. And we all know the story, right? We all know Mrs. Smith. But what happens then is that Mrs. Smith's appointment's at 2 and you're having all these thoughts at 8:30. And so from 8:30 to 2, you're dreading seeing Mrs. Smith. And then Mrs. Smith shows up late because of course she does. That's what Mrs. Smith does. And so then you're already in this story about how Mrs. Smith is difficult and this whole interaction is going to be hard and now she's late and there's so many layers to this. And then you go in and when you're having all those thoughts, you sort of feel jumpy, you feel defensive, you feel maybe a little angry, and all of that comes out at Mrs. Smith. And then she responds to that differently. And maybe she's a little more argumentative than usual because you're coming at her, right? And so the interaction goes exactly the way you thought it would. Mrs. Smith leaves unhappy. You finish the appointment unhappy, and that's your day, right? And so when I started to realize, or when I started to practice, I guess, tamping that down, not in a way to say, like, this isn't happening, but in a way to say, wow, I just saw Mrs. Smith on the schedule, and I'm feeling a little anxious about that because sometimes she can be difficult. What I'm going to try to do is show up to this interaction differently. I'm going to not have this story in my head about how terrible this is going to be. I'm going to sit down. I'm going to take my time. I'm not going to rush her. And I'm going to do a little experiment and see if I feel better after that appointment. And shockingly, it worked, right? It's wild how when you show up differently, the entire thing changes. And I think that that's a big thing that I sort of focus on in coaching is that your thoughts can be a predictor of an outcome, whether that's positive or negative. And there are ways to sort of change how you're thinking in a way that still acknowledges the thoughts that you're having, right? Because all the research shows if you just like pretend those aren't real or you do that like I'm going to think positively, like it doesn't work. That approach does not work. What does is saying, I hear this thought. I know my brain is trying to protect me. I'm going to say, thanks, I appreciate it. I don't need it today. I'm going to move on to something else. And that takes so much time and so much energy and so much practice. But the more I started to do that, the more I realized that I was feeling better at the end of my day. And my technicians were feeling better at the end of their day. And that was wild to me. And so that's what I mean when I say, like, let's flip the negative narrative and say, in a way that we can kind of get out of that loop in a way that we end up feeling a little bit differently at the
Yeah,
end of the day.
fabulous. So I really appreciate this highlighting of the negative thoughts we may be having in our head, and you highlight the need to be mindful first, to even be aware that it's going on. So sometimes we just live in this, soup that is our brain, and we have these thoughts that are automatically generated. We may have been doing this our whole life. So even having the wherewithal, and I think coaching is great for this, to say, slow it down and just notice, like, what is that feeling you just had when you saw Mrs. Smith on the schedule? Oh, it was a bit of anxiousness. And then my mind started making up all these stories about how it's going to go wrong. And that polluted my whole day and it made it really bad. The second thing I love about your story, your example, was the willingness to experiment. That you said, you know what? Let me try this other way. I'm going to experiment with going into the room with Mrs. Smith with a whole different energy and attitude. And let's just see what happened. And guess what? You could run like 5 different experiments if you wanted to and see which one you like. I think that flexibility and that kind of lightness that you're bringing in could be very appealing to those people listening. And I'm reminded when I was in school training to become a therapist, one of the things that they worked with us on was very much noticing I won't use all the fancy lingo because it gets boring, but essentially the responses we may have to different kinds of clients, and noticing if our energy gets drained or if we feel really excited, and just all these different internal experiences, and to become very aware of those. And that can be a sign of burnout too, of when we become overly negative, just in general, like, I don't want to see this person. This is such a drag. That's a sign that we might need some self-care. We might need to step back. It might not even really be about the client. It might be that your client reminds you of somebody else. It's very complex. So you did such a lovely job of highlighting that process of being aware of it first. And I liked your inner self-talk about how you sort of coached yourself a bit of, okay, I'm feeling anxious. Do you have any other stories like that? Maybe ones you're using with the new doctors that you're currently coaching, or from yourself, where you're talking to yourself and kind of coaching yourself versus having a coach you?
Yeah, yeah. And I think just on the experimentation, I'm a scientist and I also didn't believe it was going to work. So for those that are listening, I thought all of this was BS too until I started doing it. Yeah. So I think with the new grads, I think a lot of what we identify that they kind of struggle with is confidence. And in coaching them, it's kind of fun because one of the first things I say is, do you believe you're a leader in your hospital? And they all say no. And I say, guess what? You are. Whether you feel like one or not, or whether you want to be one or not, you are now. And so how you sort of behave in these situations, like, people are watching you and you can be a model. And so kind of trying to figure out where their individual lack of confidence stems from, whether it stems from anxiety about perfectionism, or whether it stems from like other things that have happened in their education, or cases that have gone not the way that they want them to. And so it's kind of a lot of like individual conversation, but also talking about how you can't tie yourself to the outcomes of your patients. And so if your lack of confidence is coming from, I did what I thought was right and it didn't go the way that it should have gone, therefore I'm not a good doctor. That's a coachable moment, right? Like, that's such a moment where you say, okay, here, what stories are you hearing? What words are going through your head right now? And how do you go from the plan I chose for this patient didn't work to my medicine is a failure, right? the plan you chose versus the way the patient responded to the plan
Mhm.
versus the owner's compliance with the plan versus right like there's more that goes into that. And so if you think that when things go wrong it's all your fault, you're not looking at the whole picture.
Not very
And
accurate, is
so
it? It's not very
right.
accurate.
It's
Mm-mm.
not the whole story. It's not the whole story. But we tend to, on the flip side of that, we tend to, when things go right, that means I'm good. That means I did the right thing. That means I'm a good doctor and I know what I'm doing and. And so I kind of encourage them too to remember that you weren't the one giving those ear meds twice a day. That
Yep.
that was maybe that was Mrs. Smith. That was the client implementing your plan and the dog allowing the client to implement your plan, right? And so larger conversations, but yeah, I think it's just so fun to work with them. It really is.
Yes, it's such a great example too. I know something else that you and I had touched on in our previous conversation. What you're saying reminds me of this, which are, one-on-one solutions, like you're helping an individual versus trying to help them see more of the context or the system around them. Because the beginning of our conversation, we're kind of coming back to the beginning where you and I both felt like we had failed. We did something wrong, that we were feeling burned out. It must be us as individuals. So we might seek out individual help, and individual coaching is great. But there's also the need to look at the system around us and everything, the context that's happening. And I'd love for you to speak to that because I thought you had some really insightful points.
Yeah, I think we need to be cautious of recommending individual solutions to systemic problems. And I feel like when I was really at my lowest sort of burnout feelings, I had a mentor say, I think you should try meditation. As in that would be the solution to my burnout. And spoiler alert, it absolutely was not. But I think that one of the things that sort of touches back on some of the other stuff is that, you know, you can't change what's happening around you directly by yourself. And I think that was one of the things that kept me stuck for so long is that I was in a culture that was like borderline toxic that I couldn't change. And I felt kind of powerless in that. And so at the time, the way that I changed that was getting out of it. But as I continued to work, I think what I realized was I may not be able to change this externally, but I can change this from the inside out. And so I think that some of these individual solutions that we're talking about, the implementations, the thought patterns and things like that, yeah, it's a lot of work and it's really frustrating to be doing that work when the system around you feels so broken. But one of the things that I have seen time and time again is that all it takes is one person in a clinic to change how they're responding to things and to maybe respond instead of react and to come with different ideas about how they're going to approach their day. All it takes is one person for that to kind of percolate through the rest of the system, and that people start to see, she doesn't hate her job anymore. Like, what's she doing? How is this working for her? And I think that the more of us that talk about this and the more of us that do this work and coach and get coached and coach each other and have conversations about the fact that the culture of veterinary medicine by and large needs to change. I think that everybody is in agreement systemically.
Mhm.
None of us agree on how that happens, but I think every time somebody does the work, we shift the needle.
Mhm.
And I think that's the story, right? Is that when a bunch of resilient individuals get together, we can move mountains, but
Exactly.
we don't move them all at once.
Mhm. Oh, I love your message. I always talk about we're all a bunch of draft horses. We just need to strap in and pull together, a bunch of ponies. Don't just like run in chaotic different directions if we can align
Right.
and really shift things. I mean, think about, I was imagining, working in a hospital, in a clinic where if one person shifted from the blame mindset of, oh, I screwed that up, I'm a terrible doctor, I'm a terrible technician, everything sucks to self compassion. Wow, that didn't go the way I wanted it to go. I feel really upset right now. Hopefully I can learn from that. Let's do better next time. Hey guys, let's rally around this. It's okay. It was that did not go the way we wanted it to. What did we learn? What can we do better next time? Is everybody okay? Right? And it would just be one person kind of uh, drawing everybody into that second conversation versus spinning out alone in a negative spiral. Everybody around them feeling like maybe I should blame myself. Maybe I didn't do the right thing. I don't know how to help. It's just we call that emotional contagion, right?
Yep.
That emotions are very contagious. And I so love the idea of being able to picture all of us having this vision of the cultural shift that we want to see and not being afraid to speak up and try to model what we want, to go after what we want. And I'll bring this as we're coming down the home stretch. We talked about hope, having hope, and also about transferable skills, that these things we're talking about today that are right here to use in your veterinary practice, they can also be used in many areas of life. I'd love for you to speak more about hope and how we can take the things we're talking about today and use them beyond our professional life.
Yeah, I think hope to me is the belief that things can be better. And if you don't have hope, change doesn't happen. I think change happens on the other side of hope. I think that some of the skills that I learned in communicating with clients or sort of going through the way that my thought patterns work and how I show up, I would say to anybody that is in a partnership with another human, these are very transferable skills. I think that my relationship with my husband is better just because I show up to conversations as a different person than I used to, and I respond more than I react, which I think at first was a little bit strange to when I first started practicing that. I was like, who is this person? But in relationships with friends and strangers, and I think that there's a lot to be said about connections between humans. And I think what we do in veterinary medicine, it's for the animals, but it's also for their people. And I think that this work really helps highlight some of that.
Yes, that's beautiful. I so have enjoyed being able to take skills that I've learned through coaching and therapy and be able to apply them so broadly. Because once you get comfortable with practicing something, so like responding versus reacting, or active listening, or really successful ways to work through conflict, it's the proof is in the pudding, right? Once you start doing it and you see the positive impact that's happening, you don't ever want to go back to the old way. And that's where you get so excited to want to teach other people. And this is where, your story of you went through this, you experienced how helpful it was. And now here you are mentoring and coaching young doctors. And it's really a beautiful way to give back and to have that ripple effect. And imagine the coach who coached you must be feeling pretty proud too, to see you now in a coaching position and you're just spreading it amongst more and more doctors. I think it's really wonderful.
It's definitely pretty cool. And I think it's the most rewarding job I've had.
Yeah, I can sympathize with that. I feel the same way. I love coaching. Are there any key takeaways for the listeners today? If they're just trying to bring all this to a close, again, I'm kind of going back to those people listening who may feel like they're struggling, or they know somebody who's struggling and they're thinking, gosh, yeah, they're kind of in that, maybe they're entering the burnout zone. It'd be really great for them to get some help. I hope that they can hear this and receive it. Any takeaways you would want for them to have today?
Yeah, I think the first thing is that you are not alone in that. That I think burnout in vet med, burnout in the US, burnout globally is becoming more of a conversation. And so the first thing I would say is speak up. Speak up to your leadership, to your family, to your friends. Let people know that you're having a hard time. I think that was one of the things for me that kept me stuck a little bit longer, is that I had maybe some shame around feeling that way, like I was a failure. And I think I tried to fix it by myself for too long. So if you're feeling like you might be at the beginning, talk to somebody now, because it might actually save you from going through some of the things that we're talking about. I think the other thing that I would say is if you don't like the situation, if you don't like the way that you're thinking about things, if you don't like the way you're showing up on a daily basis, you don't have to be that person. You can actually change. And that was such a freeing thing to me to realize that all of the things that I had been struggling with or maybe didn't like about myself in the way that I was interacting with people, I wasn't married to that. I wasn't stuck with that. That I could actually reinvent myself and kind of become a different person. And that is, I think, one of the coolest things about this journey and about coaching is that you absolutely can change. You can change your environment, you can change yourself, and it makes a difference.
I love that. I think that's a great note to end on, that you have permission to change and you have the ability to change. And the thing is, it's always scary. Transitions are always a bit frightening because we don't know what's on the other side, but they're also exciting. When we study the neurochemistry and the patterns in our brain that are firing when it comes to anxiety versus excitement, they're very, very similar. So you might be like, I'm scared, but I'm also excited. It's like a roller coaster. And having somebody to go along with you, I think that's what feels so nice about coaching, is to kind of have that partner in crime who can support you and mindfully deciding what steps to take and what experiments to run in your own life and how you might want to navigate that change. I think it's a really lovely invitation. And for people listening today that might be interested in connecting with you, where can they find out more about you and how they get in touch?
Yeah. So my company is Unlocking Vet Med. You can find me at unlockingvetmed.com. It's pretty self-explanatory. My email is on the site, but it's also Caitlin at unlockingvetmed.com. Or you can find me on LinkedIn.
Excellent. Well, Dr. Caitlin, I really appreciate you being on today. It's been really fun, and I've really enjoyed this conversation.
Thanks so much, Crystal. This is awesome.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.